Today, I have with me somebody who has been instrumental in my life, really was life changing meeting her. And I want to introduce you to her because I know she is going to give you so much value. We're going to be talking hormones, we're going to be talking thyroid health, and a special segment on brain health. Today, I have with me Melissa Parra. She is a certified nurse practitioner. She's my practitioner. I've been with her for over 10 years now. She has been in the medical field for over 30 years. As an integrative medicine practitioner, she combines family medicine with Western medicine. Melissa specializes in balancing hormones using bioidentical hormone therapy for both men and women. And she also works with patients on their weight optimization and nutrition. She treats athletes and bodybuilding competitors. That's how I came to her. She uses a body scan and extensive labs to make sure that they are achieving results in a safe manner. Melissa is a member of the Navajo Tribe and serves on the board of directors for First Nations Clinic, a nonprofit organization which serves American Indians along with underserved populations in our community. Melissa, welcome to the show.
Thank you, Carol. Thank you for inviting me. I really appreciate it.
I'm so excited. We just came from lunch and we talked all things hormones, thyroid. We went over everything. So it's going to be like you're a little fly on the wall and can kind of take in all of our conversation. And I know you're going to enjoy this. So we're going to start by diving into HRT, hormone replacement therapy. And I just want to ask a quick question. I don't want to make assumptions of the listener. I'm going to ask Melissa the difference between the bioidentical and just hormone replacement therapy.
Okay, so I'm extremely passionate about bioidentical hormones. I have been on them since I was 31, and I'm going to be 61 soon. So that's 30 years, which is amazing. I don't plan on getting off of them anytime soon. So bioidentical hormones were founded by a man in Mexico who is playing with wild yam and soy.
That's funny.
That's plant medicine. Compounding pharmacies make these. There's plenty in town here in Albuquerque and all over the United States. We mostly use wild yam now because of the soy allergies. Bioidentical or bioequivalent hormones match chemically your own hormones in your body. So if I'm going to put a hormone in my body, I want it to match the hormones in my body. If you look at Premarin from horse urine, pregnant mare's urine, synthetic hormones, those were also founded in about 1940s at the same time with a man who was, looking at pregnant horses' urine and made estrogen. And the studies that have come out since then, the Women's Health Initiative, et cetera, found that those are rather dangerous hormones. I have never been on those hormones. I try to get women, if they're on those type of hormones, to switch over to the bioidentical because I believe they're safer, more breast protective. Most breast cancers, ovarian cancers, are genetic. They're not really driven by hormones, by the way. And so I love these type of hormones. The research backs the bioidentical hormones, but there needs to be a lot more studies because it's very hard to study bioid hormones. Most of the studies have been done in Europe and Asia. We're still lagging behind, but we're getting there slowly. So that's it in a little nutshell.
I learned a couple of things. I knew about the mares and the horse urine. Didn't know it was a man playing around with them.
Yeah, the man.
And the man from Mexico. That's funny, playing around with yams. And here we are.
Right.
So I want to dive into different methods for hormones. So we have, the three that come to mind, obviously estrogen first, progesterone, and then testosterone. So we can hit kind of briefly on those. And then what is the best delivery method? Because women are constantly asking me, how should they be using these hormones?
Right. So the one delivery method I do stay away from are the pellets. I believe for women, they're too strong. I don't think they're managed very well. They're very costly. You have to get cut under the skin about every 3 to 4 months, and they put the pellets under the skin. The problem with those is you surge the estrogen and testosterone, and then you dip. There's not a constant delivery system. Also, a lot of these women are coming to me and their testosterone levels might be 300, 500, which is a man's level.
Wow.
And estrogen, I mean, testosterone can convert to estrogen. So if you're on testosterone pellets, you can start bleeding, having all of these symptoms. If the T level goes high, you can lose hair. I had a woman that ended up in the ER. She was vaginal bleeding, 72 on pellets, vaginally bleeding, heart arrhythmias. She thought she was having a heart attack. Her testosterone level was 700. And then her estrogen was so high, she was bleeding. She needed a DNC, on and on. Got her, you know, there's certain supplements you can pull that off of if you work with me. And then we switch you over to the bioidenticals. So pellets, I'm not a fan of. Transdermal therapy, so patches, creams, are probably the safest delivery system because they're not going through first pass, which is the liver, the kidney, or the GI system. So they're mostly safe. One of the downfalls that might happen with topical hormones is you don't know if you're going to absorb them or not. Your skin could be too oily or dry. So you get the levels. Some women say it didn't faze me. I don't feel anything. I'll use maybe, you know, inner arm, thigh, for some women patches. Those are pretty safe, but you don't know if a woman's going to absorb them. So it's a little bit of a downfall on those. I do like also lozenges. They're called troches. Lozenges, another issue is maybe the delivery system. They're very safe, but they, depending on your saliva, how much you produce, you might not be absorbing those efficiently. And you can take all of these delivery systems for estrogen, progesterone, testosterone, DHEA. Pregnenolone is another big hormone. It's like a master hormone I use. And then capsules. Capsules are another idea. You can put estrogen and progesterone in a capsule. I don't put testosterone usually in capsules because then it has to go through the liver. So I'd rather use testosterone like on the labia, vaginally, or on the skin. I do use drops in some women under the tongue, sublingual drops. For some really sensitive people, I might use a few drops and you can combine those in a little dropper. I have tried the oils before. In some patients, they weren't so effective. I'm not saying in women they aren't a choice. They are transdermal, but the delivery system was a bit off. You know, you shake the oil and sometimes you'll get maybe instead of 2 drops, 4 drops, things like that. So there's some inconsistencies there, but they are organic. So what I love about the bioidenticals in general is you can mix and match. And that's why follow-up is so important, because you might be on the same dose for 2 or 3 years, but a woman has different phases in her lifetime. So it's good to reevaluate. Somebody might say, I'm tired of using the topical gels, or I don't want a capsule anymore, I'm tired of the patch. What else can we do? So these are very tailor-made. Western medicine is kind of cookie cutter with the hormones for women. You get these dosages, that's all you get. Medroxyprogesterone is very unsafe for the breast tissue, and that's synthetic progesterone. Bioidentical, micronized, comes in capsules, lozenges, we talked about that, topical drops, things like that. So I love the bioidenticals for that reason. And that's kind of the overview of delivery systems. And once again, I might like capsule, you might like patch, she might like gels. Oh, you can also put estrogen, progesterone on the vulvar area. So that is also an idea. If somebody doesn't want to use it on the skin, they can do their daily dose on the lips of the vagina, vulvar area. That can work too.
So many different methods. And as you can see, it's not a one size fits all. Something I love about Melissa is she's going to look at you individually and what you need. Because we were talking over lunch about some women being estrogen sensitive. So they might need very, very small micro doses. Others might need more. And then, of course, the delivery system. Now, you mentioned pregnenolone, and I've been hearing, what was
Right,
it?
pregnenolone.
Yes. Yeah, I couldn't get that out.
I used to use it a lot more than now, but I'm getting, you know, every couple of years I revamp my thinking and I look at different things. I might add pregnenolone is like the master hormone. It helps make all the hormones.
Okay.
But it really can chill a woman out. It can help with the stress, the cortisol, and you could add maybe 5 milligrams of pregnenolone to a topical gel, or maybe to testosterone. And you can also add maybe a little bit of DHEA. So pregnenolone and DHEA help cortisol. And you can do a whole thing on cortisol, right?
Oh, yes.
Everybody thinks, oh, I should have low cortisol. Well, you don't want it too low, but you don't want it too high. So what happens is I have women going into a health food store, a vitamin store, and they bring back an adaptogenic adrenal herb and they say, I'm on this. And I said, well, we're trying to lower your cortisol. It's like 30, should be under 20. You're on something that is pumping it up even more. And they don't understand that just because you see adrenal supplement, well, is that to raise the cortisol or is that to lower it? Because it should be in a certain range. Cortisol is paid for on a blood draw by 9 a.m. It's not drawn a lot of people don't know how to manage it. You can also do saliva testing with cortisol. You can do 4 times a day for cortisol. Those are for my really stressed out people, because nobody's going to draw your blood 4 times a day. But pregnenolone and DHA also help with cortisol levels.
So something like the Dutch test you would see in real time, what's happening throughout the day with cortisol?
Right. You can do a Dutch test too. They're a little pricey, but a Dutch test. Sometimes you can also do hormone panels with blood. The problem with blood is it is bound to protein. You'll get an idea of it. Saliva is probably my favorite. I've been using that for years. You can do a blood spot, a urine spot, the Dutch test. You have to look at price too, price point with people. And then I have people with no insurance that can't afford much of anything. So I go by symptoms. I have a symptom sheet, and I've been doing this a long time, 24 years balancing hormones. So I can kind of tell by symptom, okay, breast tenderness, too much estrogen. What are we going to do? Is it vaginal estrogen with your patch or oral? Then we need to reevaluate that. Extreme depression, water retention, bloating, maybe too much progesterone. Testosterone, irritability, hair loss can be, your hair can grow with testosterone. Nobody has a beard that I treat with testosterone. A little peach fuzz, we all get that. But, testosterone helps hair growth. So it's not just for sex drive, it's for muscle growth, for confidence. I remember when I was going through menopause, I would couldn't make a decision. I kept vacillating, and that's not like me. Started the testosterone, my level was low, and it didn't make me aggressive. I was more assertive, and I could make my decisions a little more refined and quickly. So, because you get foggy hormone brain.
You do.
I mean, women can get brain fog and a bunch of other symptoms. So I have a nice symptom list when my ladies see me and they fill that out. Then looking at all the other pieces of the puzzle, you have to address, of course, the cortisol, the thyroid, all these hormones in general. And then once they get in the zone, they might see me once every 6 months. If they have another provider, maybe once a year. But on testosterone, I really like to see my ladies every 6 months because it can have side effects. And it is, you have to report that to the DEA. I mean, it's just a controlled substance. Even the bioidenticals are controlled.
Wow. Yeah, testosterone, I think, is so tricky because women will get a pellet and get that flood in and initially feel like great. And then they're continually chasing that.
Right.
And
up and down, up and down. So the delivery systems I love for testosterone, you could put it cream on your arm or inner thigh. You can do lozenges. You can do cream topically on the labia or intravaginally. But if nobody's responding to anything, I have some women that they're not responding to any of that. Or I have a woman that is bipolar. She's on a lot of psych medications that tank your libido. Other women who have been on birth control pills for years lowers the testosterone, sometimes long term. So, because it pushes it down. That's why it helps for acne. It really pushes the T down. Some medications push that down. So a lot of different factors in there. A lack of exercise can push the level down, but not everybody can increase their T levels just naturally. So I have a few women. Yes, testosterone for women is not FDA approved, but I've been doing this for women for probably, like I said, 20 years safely, of course. And some of my women are on little injection 2 times a week of testosterone, but it's such a baby dose, like 5 milligrams. Men are on 100 to 200
Wow.
milligrams. So
Yeah.
that's how we're so different,
So
right?
different.
We have testosterone, but our level shouldn't be, over maybe 70. A man's level can be up to 1200. So we're very different. Men have estrogen. They don't want high estrogen. They get man boobs, water retention, emotional,
Yes.
can't pull off the weight. So I treat men too. And men can do lozenges. They can do topical gels or injections, things like that. So there's a lot of cool things about all of that. And vaginal health is important too. So Carol and I were talking, if you're on estrogen and progesterone, so you do need the progesterone, and you're on a vaginal cream or a vaginal tablet in the vagina, and you're getting breast tenderness, we can either lower one or the other, but most of the time I back off on the vaginal estrogen. I was telling Carol, we can use hyaluronic acid, vaginal suppositories or cream. There is one on Amazon, but it's got a lot of chemicals in it. So I prefer compounded. And that regenerates the vaginal tissue without having the estrogen component of it. You can do that 3 or 4 times a week. HLA, hyaluronic acid, is good for skin. It's good for joint collagen. So I take an oral supplement. I also give the vaginal, and then you can use it on your skin too. Very anti-wrinkle, cool stuff.
Yes.
So there's a lot of other DHA you can use vaginally. There's a lot of other choices. You don't have to always say, I have to have vaginal estrogen. I have to have that. You can do other modalities of that too.
That's really good to know. That was news to me about this other method, because as we go through menopause, we lose that protection of estrogen. Of course, we can experience profound bone loss over time and lose a lot of the, I'm assuming, cardiovascular benefits as well, brain health, which we're going to talk about a little bit later. But one of the things is that vaginal dryness and then atrophy,
right? Because people think, well, I don't have any vaginal dryness, I don't need any estrogen. But I have ladies coming in with frequent UTIs. So the urethra is close to the vagina. If you get tissue degradation, and there's research articles showing vaginal estrogen. I use estriol mostly. There's 3 estrogens in the body. Estrogen, estrone, very potent in menopause. We don't use that in the bioidentical world. And estriol. That prepares the womb for birth. So it makes sense if you're going to use a weaker estrogen, use it in the vagina. It kind of makes sense, right? So there's a weaker estrogen, and then watch them over time. The other thing is, my mother was getting 4 UTIs a year. I put her on vaginal cream 3 times a week. She didn't get a UTI for about 2 to 3 years. And the studies are there because you get the tissue degradation. Also, urinary incontinence. If you get it early enough, you can make the tissue stable. So there's less maybe bladder falling, uterus falling, things like that. So if you have a pessary, which is for incontinence, you do have to use vaginal cream so that the tissue will hold on to the pessary as well. Very interesting.
It is interesting. I'm learning some things that I did not know. With the atrophy, sound like an odd question, but is the vagina actually like shrinking? Is it?
Oh, yes. I had a woman who was not sexually active. She was 45. Her husband died. She was a widow for 20 years. Well, she kept getting bladder infections. And I said, I have to examine your vaginal area. I have a very tiny finger. I couldn't even, she had what we call vaginal stenosis, where her vagina literally closed up. I could not get my finger, well, now not even a speculum, but my little finger in the opening of the vagina. So I had to refer to OBGYN. What did they do? Dilated her with a small apparatus like the size of a ballpoint pen while using estrogen cream to get it opened up, because I think that's why she was getting bladder infections. So I tell women, and men, blood flow. If you're not sexually active, you don't use it. It will, and men too, they'll get backup of their plumbing system. There won't be any blood flow for men, the prostate, all that. For women, no blood flow, atrophy, closing up, dryness. And then you can just feel uncomfortable. You can feel sore or maybe I have an infection, and it's really just a lack of estrogen in the vagina.
Wow, these
Yeah.
things I was never told.
Yeah, I
you
wasn't
know.
told it either. I had to learn on my own and reading. Yeah, some of us just didn't get that education.
And this is why these discussions are so important for the listeners, because I know when I went through my journey, no one was having this discussion, and there was a shroud of shame even around the word menopause. You didn't want to even talk to anybody. I wasn't even comfortable really talking with my doctor about it.
Mhm.
And it wasn't until I met Melissa that I started to really understand what was happening with my body and what was really going to serve me. I just want to touch briefly on the men and sexual
Mhm.
dysfunction. With that blood flow, I'm assuming, just like what you described, would be one of the causes, correct?
Yeah, ED is can be complex. So erectile dysfunction, low sex drive in men. Some of the younger men that I'm seeing are overweight. They're not going to the gym. They're not eating well. That will dump your T level. Some have chronic illnesses, a blood flow issue. Some are not sexually active, a blood flow issue. Some have cardiovascular issues. So the penis is filled with very small arteries. If your main arteries are getting clogged with cholesterol, well, what do you think is happening to the arteries in the penis, right? So on my guys, well, Carol knows, my initial panel of blood work for women or men is a lot. Like I do a lot of blood work because I want the whole picture, and labs don't lie. So if a man has high cholesterol, my goal is to lower that, get them eating better, blood flow, and then the testosterone levels. Like where's the free and the total? Do they have BPH or enlarged prostate? And I love it. I love seeing the men. They're very they want to feel better, because it's not just libido for men's testosterone.
Mhm.
It's belly fat, it's poor sleep, it's depression, it's low motivation, it's sarcopenia, muscle loss. They don't have the oomph. And then with men too, you got to look at thyroid, you have to look at cortisol, blood sugar. All these things play a role in ED or low libido in men. So, and when people come and see me at the labs, I say it's never one thing. We're probably going to see 2 or 3 things pop up.
Right.
But if you work with me, we'll get it in the zone. And my guys on testosterone, I see them every 6 months, because testosterone can convert to estrogen. You don't want man boobs if you're a guy. We talk about that. You block it. And then it is a controlled substance, and some of them want more is not necessarily
Yeah.
better. Because when the receptors get filled, where is it going to go? It'll convert to estrogen or DHT, dihydrotestosterone, cause balding, prostate issues. So it is a balance. I'm not an endocrinologist, but I've been doing this a long time, and researching, working with others, and it's a balance of everything.
Yes, I can see
I
that.
love seeing the men too. Men, you can use DHA as well.
And so really ED, it's more than just the loss of libido. It could be a major health issue.
Mhm.
It could be a warning sign.
Big time warning sign. I've seen it in kidney disease, levels in 30-year-old men of like 150. And I'm thinking, this is not just hypogonadism, like what else is going? Pituitary, drop prolactin level. Do they have a pituitary tumor, which is not cancerous? It could be benign. It's a full blood does not lie, and it's just synergistically balance of everything. So yeah, it's pretty interesting. It's very
Very,
fascinating.
very. I want to shift gears just slightly and talk about the thyroid function, because this is something I experienced myself when I went through menopause a little bit down the road, and I was diagnosed with rheumatoid arthritis. I don't know if that played into it as well. And then I was getting ready for a show and on a heavy keto diet, which I later found is not so great for your thyroid. So I did experience this, but in working with women, especially over 50, I find it to be extremely common.
It is common. More women have thyroid dysfunction than men. We don't know why. We really don't. It's sad to me when I see a woman come in with a 40-pound weight gain, and they've been telling their provider for 7 years, 5, 6 years, I'm gaining weight. They have maybe 80% of low thyroid symptoms. Their hair loss, cold or hot intolerance, weight gain, fatigue. They're working out at the gym 5 days a week. They're eating clean. All of these things are going on. And then I told Carol I had a case where a woman's thyroid antibodies are very high, but her thyroid levels are fine. but you have to listen to the patient. And I always do antibodies on all my patients because her levels are over 1,000. They should be under 35. And then she said, my throat kind of hurts. I feel raspy. I feel like it's swelling a little bit. So we did a thyroid ultrasound, and she had a lot of little nodules on her thyroid. So changing her diet up, some supplements as well. I have some supplements at work that I do with thyroid, cleaning up the gut biome. We're going to do a food allergy sensitivity. It's not a true allergy, but you have food sensitivities because she did FODMAP diet, anti-inflammatory diet. It wasn't helping too much. She got gluten-free. So we got from 1,000 of her antibodies to 600, but we still have room to go, and they can lower. I talked to an endocrinologist, a very well-known man here in Albuquerque, and he was rather cross with me one day, and he said, you can't lower thyroid antibodies, you just leave them alone. That is not true. I've seen 2,000 in one gentleman, and now he's at 129. I just saw him a couple days ago. It's taken time. But there is truth to gluten-free diets, clean eating, pulling off of a lot of inflammatory foods. But the food sensitivity test that I do hones in on your immune system so that it's specific. You pull those foods away for 3 months, do a reintroduction diet, and then watch your body how it goes. So thyroid's fascinating. But I think a lot of women and some men have it. The older we get, over the age of 65, a lot of women and men will develop an underactive thyroid. I treat it, but some geriatric doctors don't treat it. They will let the TSH go high, and they'll say, I've heard this, they'll say, oh, well, everybody as they get older, the thyroid kind of poops out. Well, what I would like to be a healthy 80-year-old, 70-year-old person, and if my thyroid is borderline, I would like my provider to treat it. So I see that. So just because we get older, why do we have to accept that kind of answer when the lab work doesn't lie? And I was also telling Carol that I prefer porcine thyroid from pig animals. So Armour thyroid and Nature thyroid are the most that I use. They have T3 and T4 combinations, and the thyroid is made of T3, T4 hormone. Western medicine uses levothyroxine or Synthroid, that's T4. It is a poor converter in most people to T3. So if people don't want to change to porcine thyroid, it can also be compounded at a pharmacy. So you can kind of alter each dose as well when I do the labs. It's tolerated better. Our bodies, we use valves, pig valves. So we are similar to the pig animal, right? Yes. So that's why I think people feel better on it. And there's minimal fillers. When you're on levothyroxine or liothyronine, which is T3, if they don't want to get off levothyroxine, I'll say, well, let's add a little T3 because your T3 number might be 1.5. I like about 3.5 on the level. You add that T3 either in the morning with the T4, or maybe my soccer mom's around 1, 2, 3, 4, 5. T3 is long acting. It's going to give you a punch in the afternoon and really make a difference. My people are saying, I'm falling asleep at 2 or 3 in the afternoon. So there's so many different ways to take T3 and T4. And Roland, once again, it's genetics. You can't say, well, my friend is on this, so I need that because I'm going to do just as good as her. I'm going, well, you're a different genetic makeup. Yeah, and that goes with everything, medications, diet, even everything. So I'm a fan of the porcine thyroid, but I will balance with synthetic as well. But they do have more fillers and more side effects. Now I have to tell you what the fillers are. Who knows? I don't know.
Yeah, who knows? When you hear the word fillers, it could be anything. I can say from personal experience, the first thing I noticed was not needing the 2, 3 o'clock nap, because that had become something that was like, I couldn't function. I couldn't get through the rest of the day without that nap. And I don't do that anymore. I haven't done it in years.
Right. It's pretty fascinating. And, I think old school thinking with endocrinologists is they just want to use T4. Some of my patients will come back and say, I have a new doctor. He didn't want to refill my T3. And I'm thinking, well, that's kind of silly. Why did they make T3 in the first place? Right. Why has it been around for many, many years? If you Go to more progressive states, Florida, Oregon, California, Denver, Colorado. They use a lot more T3. There's more integrative medicine, especially in Florida. I learn a lot from different providers in different states. We're a little slow here with stuff, but I think we're learning over time.
Mhm.
And what I wanted to mention too with thyroid is that, yeah, a lot of different things clear up, but if you're underactive thyroid, and anything that slows the brain down, so hypothyroidism untreated can cause brain fog, possibly lead to early dementia, because you're slowing the brain down by not treating the thyroid. And I forgot to mention this with estrogen, is that estrogen helps neuroplasticity in the brain.
Mhm.
So it helps the neurons fire in your brain. It helps with focus. It helps rewire the brain cells. It helps with glucose or sugar uptake. So estrogen is very important for the brain. And, I think some women are afraid of estrogen, not so much progesterone. So I'll tell them, well, maybe we'll use like a progesterone capsule on you and just use a touch of topical estrogen.
Mhm.
So you're getting a little bit of the benefit, or vulvar. So you're getting a little bit of the benefit for your brain health and skin and things like that, and a little bit of bone. So some women are really afraid of hormones. They're saying, I only want hormones. The Menopause Society says 5 years and that's it. I completely disagree with that. Maybe if you're on birth control pills or Premarin or Prempro, that might be the case, but there's a fear that's instilled sometimes by Western medicine that I have women, you're going to give me breast cancer if you give me hormones.
Mhm.
I'm actually, no, I've been doing this a really long time. I believe in practicing safe medicine. So very interesting. And there was a study that came out in October that was released by the Institute of Neurodegenerative Disease in Florida. I wrote that down. But what they found was if you start estrogen and progesterone when you're menopausal, your midlife after a hysterectomy, or when you're starting to have hot flashes, night sweats, etc., or other symptoms, and you stay on those hormones for 10 years, your risk of dementia and Alzheimer's goes down 26%.
Wow.
That was cool.
Significant.
It is a double-blind, random, placebo-controlled trial. Very valid. More studies need to be done. There's one about, well, what if we just only give estrogen, but if you have an intact uterus, you do need progesterone. Hysterectomy, they think, well, now they're finding all these benefits of estrogen for women in the body, and more studies need to be done further down the road. But it was an exciting study because my mother has Alzheimer's disease, and her doctor pulled her off of hormones at 71, and her brain health just took a dive. And then after COVID, it got worse, and vascular compromise. She's had 3 mini strokes. So she has vascular dementia with Alzheimer's on top of that. So she got the double whammy.
Wow.
Yeah, that was, and I really saw a change when the hormones went down and when she retired early and when COVID came, because she stopped exercising, her diet, too much sugar, hormones gone. She was learning a Great Decisions group where they talk about world events 2 times a week. She'd go to these conferences, classroom studies. All of that went down the drain. And I really saw a big decline after that, and her bone health. So it's pretty sad. So I am passionate about brain health. I told Carol, every couple of years, I try to, broaden my mind and learn. And now thyroid is always great. Hormones, wonderful. But that all correlates with brain health as well.
Oh, yes. And I really want to dive into that, in particular, Alzheimer's. I know that's a fear for many people, especially if they have the family history. What kind of tests are you looking at?
Okay, so I am not a neurologist, but I do know that you can only diagnose Alzheimer's post-mortem after death, right? Looking at the brain on autopsy. But there's some really cool things that you can do. So I have one test at work. It's called BrainSpan. And BrainSpan is a 20-minute computer test with a finger prick blood spot omega score. So omega-3s are good for the brain, fish, omegas, and all sorts of forms. So it'll give you your omega score, you mail that in, you do a 15 to 20 minute test online. for areas of the brain. So it looks at cognitive flexibility, short-term memory, sustained attention, executive function, cell inflammation, recall, processing speed. And so it looks at these different areas of the brain. The results take a month to come back. It's a nice packet. There are certain supplements that go with deficits in the brain. One is magnesium 3 and 8. Magnesium 3 and 8 helps me with sustained attention. Magnesium 3 and 8 is the only magnesium that crosses the blood-brain barrier. Very good for prevention. I think everybody should be on it. I have a powder and capsules. It's wonderful, clean stuff. When I did mine, you want all greens. I only have had one patient with all greens. I had a couple reds, couple yellows, and the rest were greens. I had stopped some supplements, I told Carol, because I thought, I don't need that. And these areas of the brain on my test were supplements that I'd stopped. CoQ10 was one, electrolytes was one. It did show my glucose, insulin, and carbohydrate imbalance was there. I had some cell inflammation. I went back on curcumin. I went back on omegas. On electrolytes. I mean, it's pretty valid. So it's pretty cool. Now, if people don't want to do that, I say, well, we can try these supplements, but you want to look at those different areas of the brain that were tested. That's pretty neat. And that's through my office. I give people my price for the kit because I feel like everybody should have these tests, but it's a valid test to look at. One of them anyway.
I definitely plan on having it done. I was excited when she shared that with me today, because why not? If there's things we can do right now to slow this degeneration, I mean, we really should be looking into it.
Right. And I think that with testing of the brain, and I'll mention lastly, well, let's start with the ApoE4, right, gene. So the ApoE4 was initially designed for cholesterol and heart disease study, right? Like, oh, well, if you have the ApoE gene, 25% of the European population has the ApoE gene, which can show higher cardiovascular risk. So if one of my patients comes up positive with that, I check the cholesterol, I pull them off of like dairy, meat products. Usually I do other markers, LP-Little-A, ApoA and plaque 2, high screen CRP. I do all these other things through Boston Heart Lab. I like that lab. Similar to the Cleveland Clinic. So I like cardiac markers, corneal calcium score. I mean, you pull all that together for cardiovascular, it all ties together. But if you have 2 of the ApoE4 genetic variants, you are, I think it's something like 8% at a higher risk of possibly developing dementia or Alzheimer's. So I take that very seriously. So I just saw that on a patient. I have to talk to her in the next couple of weeks. She has a double variant. So what do you do with the information, right? So I like to pull all of these little factors together and explore those. And I was also telling Carol that certain medications are not good for dementia and Alzheimer's. And we didn't know this until the last couple of years. Benadryl. I have some people taking Benadryl every night for sleep. Alcohol with ZzzQuil. ZzzQuil has alcohol and Benadryl together. I have people chugging it every night to sleep. Not good for the brain. Benzodiazepines, Xanax, alprazolam, Valium. Those slow the brain down. They're very addictive. We use them for sleep, anxiety. They're meant short term or maybe here and there, but not daily. So the benzodiazepines. Also, there are some drugs that can slow you down. Ambien, Lunesta for sleep. Those are dangerous. And if you think of anything that's going to slow the brain down, it doesn't mean like melatonin's bad, things like it just means certain drugs can really predispose you for dementia. And if you've ever taken any of these drugs, sometimes the next day you feel out of it for hours.
You do, you feel weird. I know Benadryl, I was telling Melissa I had such severe allergies growing up. I got into that I didn't take it for sleep. I took it for controlling allergies. And every spring it would be so bad, I'd be popping those things. But yeah, that just completely blew my mind that was one of them. But it makes sense that it slows you down. But I did stop taking it because the next day I would feel horrible. And then I would be spacey, not just tired, but that spaced out of body kind of.
Right. It's kind of, drugged out, this drugged out feeling.
It's weird.
And people need to work more on sleep, because we really should be getting more sleep for cognitive health anyway. So that's that ApoE4 that, we run. Meds we talked about. Also, some factors that can lead to dementia as well. Believe it or not, low education in our society. Cognitive, people that are, I guess, don't let your brain go lazy. Folks, as we get older, we should be learning a new dance, a new routine of something, a new language, a new musical instrument. Or if you retired early, volunteer, but do something that's going to stimulate your brain. Crossword puzzles, there's brain games online, there's tons of stuff you can do. Lack of exercise, Carol knows this. High or low blood pressure, both are dangerous for dementia. BMI over 30, dangerous. Blood sugar high, cholesterol high. Head trauma. I see a lot of my patients, they have had maybe multiple accidents. Athletes, CTE, Muhammad Ali, Parkinson's, all these are brain issues, right? And gosh, Aaron Hernandez, when they found the CTE on MRI, it's really dangerous. But the repeated head trauma can be in there too. What else was I going to mention? Homocysteine. Okay, I check homocysteine levels on my patients. Carol knows that. Homocysteine is an oxidative marker. You want that number under 8. It looks at cellular inflammation and oxidation, which can lead up to stroke, heart disease, dementia, Alzheimer's. So you want the oxidation to go. The way you lower that is methylcobalamin and methylfolate. So methylated B12 and methylated folic acid. And the numbers do go down. I got my mother's from 19 to now she's at 12, one little tablet a day. So I like to measure those, because if you have high oxidation, what's going on? I have a young man, he was on fentanyl and addicted and everything. His homocysteine level when he was a bodybuilder and in great shape was 8. And he just saw me recently coming off these drugs. It's 30, his homocysteine. So it's a valid test. And cardiology, I don't know why they're not drawing it. Maybe more progressive cardiologists. Chronic stress, depression, chronic. You're not dealing with those. Smoking, drinking too much alcohol, lifestyle. So I try, and Carol's wonderful at working with patients with that and trying to look at the whole person. I know Carol, she just doesn't look at, oh, let's give you some muscle and exercise. She does the nutrition backing with it, with supplements, and she's always trying to learn, and that's somebody, she's passionate. I'm passionate about what I do. You want to find a provider, you have to come to me, Carol, find somebody that you trust, that you can be passionate, that is passionate about what they do.
Yes.
And then take notes. And I repeat myself a lot when I teach, because some people don't know medicine. So when they come in, I go over every lab draw. This is where you're at. Labs don't lie. And let's educate you. And I repeat it every time, because people can't remember the same things over and over. So those are kind of the triggers to possible dementia. And I did the polygenic risk map. I talked to Carol about that. It's a DNA swab in your cheeks. We offer it at our clinic. It's through Boston Heart. It will look at your genetic predisposition to not just Alzheimer's, but inflammatory bowel disease, early menopause, osteoporosis, coronary artery disease, atrial fibrillation, high cholesterol, to name a breast cancer, for men, prostate cancer. So it looks at your genetics to see if have the predisposition to that. So when I did the test, I was fine. Everything looked low. I was like, woo, but that means the rest is up to me. So genetically, I'm not predisposed to any of those. It's a valid test. I had a woman that was positive for breast cancer. I told Carol, I sent her with a test for her breast imaging and to a breast specialist and a geneticist so she could get further testing. Because maybe we can catch something earlier and do something about it than later, right?
Right. Yeah, that's really what it's all about, is what we can do right now. And Melissa was telling me how early Alzheimer's starts, because it can seem really sudden if your loved one develops it. But Can you explain to the listeners?
Well,
that
you
how-
know, when my mom started exhibiting symptoms, I look back and I think, oh, well, she was forgetting some things and doing some odd things maybe 7 years ago. But the research does show it can start 10 years earlier. So I was making some mistakes the other day. I'm hoping it's just multitasking, which we're not supposed to do,
right.
and stress and things like that. Because I leave the garage door open, and then my husband's like, "You took the keys with you." They weren't egregious. My mother's mistakes were egregious, like foil potatoes in the microwave, microwaving silverware.
Oh,
I
okay.
mean, keys in the refrigerator, you know, but I think we all get worried with mistakes as we get older.
Mhm.
So are these just regular multitasking stress mistakes? Why don't we look at these things earlier? And so it is, you know, the deal is the last test I was going to talk about was the amyloid beta ratio. We were speaking about that. This is a new test offered by Quest Lab. A few months ago, they approved it. It is a valid test. I looked at all the research. So amyloid beta is a protein that forms in your brain, some people's brains, and it clogs up your brain and it forms tau tangles and plaques. Then pretty soon, when you get to moderate dementia, like my mother now, I believe she's got a lot of these tangles and plaques present. Once you get that far, I just don't see any really promising drug that's going to help her. There are some other drugs that are on the market. They have a lot of side effects. They are new. There's some other drugs that will help prevent those plaques, but it's still really new with a lot of side effects, and they're very expensive. 25,000 a month or something, you know, something outrageous.
Wow.
Hopefully down the road we can look at that. And I have patients that say, well, I'm scared to do that lab test. I don't really want to know, but my mother had Alzheimer's, or my sister. And I look at him and I'm saying, well, you'll go for your mammogram looking for breast cancer. You'll go for a colonoscopy. This is the same thing. And I actually think brain health is so important because I am into prevention as a nurse practitioner. Carol's into prevention. And if we can hop on something sooner than later, why not? If somebody had a amyloid beta ratio that was off, I would look at their supplements. I would maybe do some of these other testing if they haven't done. I would look at their whole lifestyle. It's a whole big picture. If needed, they could go to neurology, try some of the regular medications, Aricept, Namenda on the market that can maybe slow it down a little bit. And maybe, excuse me, some of them will do like a spinal tap, looking at markers, or a PET scan, which is a functional MRI of the brain. That will give you a lot of information too. So I don't have children. I am going to be 61. I don't know that my nieces and nephews are going to take care of me if something happens, but I'm a planner. So what would I think for me, it would change maybe what I would do in the next 5, 10, 20 years. What's cool about this marker too is most Medicare covers it. If you have a family history of Alzheimer's or dementia, insurance covers it. Or if you have cognitive decline, insurance covers it. But for now, Quest Lab is the only lab that does it. And you should ask your provider. You don't have to come to me. You can, but it's called an amyloid beta marker, and it's a blood draw. And it's pretty valid. The results are back within a couple of weeks. And so far, the ones I've seen look good. But I think that there's too much fear out there. I don't want to just wait around and then one day my mind is going and I feel like I could have done something a long time ago for that.
Right. I have a friend going through this right now. She doesn't have Alzheimer's, but her mother does. And everything came kind of crashing down on them very fast. And so all of a sudden they need help because it's not safe for her to be in the home. You know, she could, I don't know, burn the house down or, hurt herself. My friend has to go to work. She's to work. And there they were just scrambling to find some type of help. And they finally did, but it was a lengthy time, a lot of stress. And so having this information, in advance for preventative reasons, but also like Melissa says, just being able to prepare and not have something, just hit you like that.
Right. I think the latest study, when I went to this Alzheimer's conference here at the Marriott last fall, it's kind of scary. They said like 1 in 5 people will end up with Alzheimer's disease.
Wow.
And so at lunch, I raised my
Statistics.
hand, this curiosity, I was like raising my hand to the panel up there. And I said, is the reason we're finding Alzheimer's more prevalent now because we're living longer? Is it environmental toxins? Is it lifestyle? Is it medications? Is it genetics? And the panel said all of the above. They said all of the
Wow.
above. We don't exactly know. But if you think about it, and I don't want to get paranoid, I try to eat clean and have clean cleaning products. But if you don't think we all don't have a glyphosate in our bodies from
Right.
Roundup, we do.
In our tissues, yeah,
Yes,
for
and they're
sure.
still using it out there. Now they don't
Mhm.
use it in Europe. Like this is what bothers me about certain things. Like
Oh,
the
yeah.
bioidenticals are very popular in Europe way before here. They don't allow drug commercials on TV to manipulate people.
Right.
They discontinued Roundup over there. They still use it here.
Oh,
So you know, they can lie to you. They can say that's not in, we don't use that in our cleaning product, and they can use it. There's tests to look at all that. I don't want to be a paranoid person and test myself to death, but environmental toxins are very much out there. Also, environmental estrogens. So anything that smells good is probably a little bit estrogenic, right? And I try to use glass, but plastics,
Right.
you know, I mean, cosmetics, like all of these things, but I don't want to run around with a gas mask and freak out because I don't think that's good. Because there are books on things about high estrogen, but I skim it because I don't want to be a paranoid person either. You can't
Mhm.
change your environment completely where you live or live in a bubble. So you can just do the best you can do with the knowledge that you have.
Exactly.
The soil's not the same as it was when we were young.
No,
All of that.
there's no way.
Our relatives pickled things. My grandma pickled everything. Well, her gut
Mhm.
was so much better.
Yeah.
You
My
know,
grandmother did too.
look at all this stuff now. I have people with horrible guts. They're getting colitis, all these things, diarrhea. Where is that coming from? Foods, toxins. It's pretty bad. And it's getting more and more prevalent and harder to treat too, even with integrated medicine. So that's the gut biome, which also goes with thyroid, which goes with Alzheimer's, which goes with weight.
Yes, it's all connected.
That's a whole nother topic, right?
I know we could go in so many
Right.
different directions. But yeah, just be aware. And I think with the information we share, it's just important that we be aware because the change is not going to happen in our culture, in this country, without people being aware and pushing for that change. So I do think it's important to have those discussions about things like glyphosate.
All of that, you know, and I think also knowing your family history, and if you don't, do a genetic risk map. You know, do look at things like that. I have people that are adopted, they have no idea. 25% of your family history is your longevity. So you want to fight the genes. If, you know, before we had all these fancy tests, I would ask people, do you have heart disease in your family, diabetes?
Oh, yeah.
That's the only way I could really do it. And some people go, I don't know what my grandparents had. I don't have any clue. My dad doesn't tell me, never goes to the doctor. And then you have people falling over at 50 of a major heart attack. You know, could have been avoided. Now we have all these tests that are pretty cool. Now, a lot of them are not covered on insurance, but they're not too expensive either. And I also don't believe in over testing. Like you can get a baseline test. Now the amyloid beta you can do every year or every 3 years or every 5 years to see like, how is my brain progressing? Is it stable?
Right.
That's cool.
That's very
And
cool.
the other ones like polygenic risk map, you do once and you're done. Some of these things like brain span, did I keep doing things? No, but I might in another year repeat that test. I did it like 3 years ago. So yeah, it's a fascinating thing. They're all hormones. They all go together. Gosh, I just love medicine. It's pretty neat. And Carol's helped me so much too with my patients and myself as well. I'm an 80%er, so I'll tell her I can only do 80% of the diet, and then I work a lot. So maybe I can't do those 6 leg exercises, but I can do 4.
Right,
You know,
right. You
and
make
then
it work
she's
for
nice
you.
to me. Yeah, she's not gonna like whip me. So I've had great success with Carol's programs and weight loss, and a great. What's nice is I have it all on my phone. So if I fall off the wagon a little bit, I've got all the exercises, all the diet
Right
to get
there.
me, and it's not. It's as hard as I want to make it. It's really not that hard. It's as hard as I want to make it. But now I have a plan when I go to the gym. I'm not willy-nilly just running in there, hopping on different machines. So cardiovascular, circulation, oxygen to the brain, and inflammation down. I think we all die of inflammation, but also circulation and oxygenation is huge. So you've got to be working with some people. And I think you got to have a little bit of a team, your doctor, OBGYN, your trainer, your dietitian, integrative people help you with your maybe therapy, group therapy, counseling, meditation, church or no church spirituality. You have to have all these facets to keep your machine going.
I agree. Yeah, we don't exist in a vacuum. It's not just one thing. It all goes together. Our mental health, our physical health, the spiritual health, all goes together. Melissa, this has been so incredible. I've enjoyed it so much. I could just go and go and go.
Yeah, we can talk forever.
Yeah, we
Carol,
do.
I mean, and I learned from Carol too, because I don't know it all. I was telling Carol, she's asked me about uric acid, it is cardiovascular risk, etc. But it's almost like the more you know, the less you know. So I try to keep it easy with my patients, and Carol knows a lot of things that I don't have any idea about. She talks to a lot of specialists, but I have an open mind and I keep looking at stuff. And there's also I always tell my patients, one day they're going to genetically say paleo's for you, modified keto for you, intermittent fasting for you. Melissa, you have to eat 4 to 5 times a day. My blood sugar drops. Genetically, there's already that research going on about your genetics and how you break down food and what diet is best for you. It's pretty new on the frontier. There's a company out, but I'm on the fence because you have to, not everybody is going to tell you the truth either. So we have to look at the research and not just jump into every little thing.
Exactly.
I hear some interesting things. So, but thank you, Carol. I love hanging out with Carol and talking with her, and I appreciate you inviting me today.
Oh, thank you, Melissa. And as we wrap up, can you tell the listeners how they can reach you, follow you?
Yeah, I have a website. It's my name, melissaparracnp.com, certified nurse practitioner, melissaparracnp.com, or you can call my office, 505-433-4349, and get an appointment. You might have to wait a couple of months, but we get cancellations here and there. And it's a full hour appointment. All the information's online. All the kits I use, what to expect. My intake form is thorough because I'm very nosy, because I have to look at everything. So, love to see anybody new, and thank you so much again.
Oh, thank you.
Have a great day, everybody, and have a nice Thanksgiving.
Yes, happy Thanksgiving. Well, by the time they see this, it might be
Later.
Christmas.
Okay.
All right.
Holiday.
Happy holidays. Bye-bye.